I'm from Europe and I'm here today to get the upper and lower eye surgery and to get a nose job. I wanted to get eye surgery because it has always been a concern to me that I always look tired, although I'm not, and people keep asking me what's wrong and exactly, and I got tired of this. And nose job, as you can see, I have a little bump up here, and this has always been like an insecurity to me, and I feel like I will be much more confident when it's removed. And the reason why I choose to do it here was because service was always friendly and everything has been taken care of for me, and I've felt very safe to be here. Yes, and I'm happy to get the surgery today.
Alright, now let's look at the mirrors. As a whole, we're going to reduce the size of the nose, okay? So we're going to reduce the width, reduce the hump here. Also a little bit of a size in the lower area. Make this portion a little bit sharper and narrow the base, as well as reducing the size of the nostrils, okay? So that if it's not too much, okay, then in that way it's going to throw off balance the other way around. So we just want the right size, and that might fit your face pretty well. And with regards to the eyelids, the eye opening size a little bit more symmetrical than right now. I think it would be better if we were to enlarge the size of this eye as well. We're going to enlarge a little bit more on this side, but both eyes are going to get a little bit larger. Now, how this is going to go is first we're going to sterilize this area here, and then we're going to give local anesthetic injections on the eyelids and in the nose area as well. Even though the nose portion will be done under mild sedation, we still need a little bit of the anesthetic injections, okay? And of course, I'm not going to give the injections when you're completely awake. I'm going to give you a mild type of sedatives. You're going to feel very weird. So you're not sleeping, but you may see some colors that go somewhere else. Okay, try not to do it too much, okay? And while you're under that influence, we're going to give the injections on both sides here, the nose area, the eyelids. And as we're finishing up with the injections, you're going to wake up. And then the eyelid areas are going to be done while you're awake. And the reason that we do that is because we need to assess your eye openings. So you're going to be awake during the procedures, and there's not going to be much pain. Now, when we do the ptosis correction part, where we tighten the eye opening muscles, that may sting a little bit. It does not hurt too much, but it may sting a little. I'm going to tell you before I do those procedures. Now, the most important part, when we give the injections or when we do anything in the eyelids that may hurt a little bit, try to relax as much as possible. If you frown, if you squint, anything that tenses the muscles is going to swell a lot, bruise a lot, and it may even hurt a lot more than it should. Okay, so try to relax as much as possible. And especially when we're doing the ptosis correction, if you squint and you just tense your muscles, the direction of that is the eye is closing. But what we're doing is we're tightening the muscles and trying to open. That means that we're working against each other. So try to relax as much as possible.
And about the tip,
yes,
I wanted to like pointy a bit, but not too
much.
To prevent the drop down.
Okay.
Exactly.
All right. Okay.
I'm excited. I didn't sleep well tonight, so.
Was it okay?
Yeah.
All right. You remember that we took a picture? So this is you before, and this is you after.
Oh, wow.
Okay, so the hump's gone, and sharpen the tip a little bit.
Yeah.
Okay, so you may feel that the philtrum area may be a little bit protruding a little bit outwards because of the swellings. That's going to go really quickly. Okay. Now with the eyes, try to open firmly. So the more you do, the faster it's going to recover.
Today morning I had a lot of blood in the eye. Is this normal?
Yes, it's normal. Okay, the swelling is actually going down a little bit.
I have a little pain in my left eye. When I look around, it stings and it feels like there's something in my eye. Is this normal?
Now this side, you can see it's a little bit more like a tube compared to the other side. That means that it's a little bit more swollen. It's not just on the outside, but it's also on the inside. So everything's a little bit swollen and it adds more pressure to the eyes. And whenever you move around, the eyelids are in the way because it's kind of pressing against it. Alright?
Yeah.
So I don't think you need to worry about that.
Can I yawn?
Yeah, sure, of course.
Because I was scared.
No, it's okay, it's okay.
Will the swelling of the eye parts go up the next days?
Now it's going to go away.
Ah, okay.
Now it's going to slowly go away.
Okay.
Alright? Okay, now the tip area it's very swollen right now on the tip area. It takes a long time for it to smooth out and for the tip to drop down a little bit, okay? Now it's going to be a lot smaller than that, so we need to take that into consideration. Now wearing makeup, starting a week from now. Putting on is okay, but removing may be a little bit of a problem because we remove the stitches a little early to prevent the stitch marks. That means that it's healed, but it's not strong. Now, it actually looks higher than before here, right? But we didn't augment anything there. We actually lowered it. There's no implant on the inside, so actually everything is going to go down. But it looks pretty high because of the swellings. This area on the tip is going to take 4 to 5 months.
Oh, wow.
A very long time, okay?
Because it looks very long.
Yes, but that is going to go away. Everything looks very high, right? Even in the bridge area. But we actually lowered the whole thing.
Oh, and what about the colors?
I would say about like 1 or 2 more weeks.
Okay. Can I touch?
Yes, touching, washing that's fine. Try not to rub it, but just washing. No smoking and no drinking for 4 more weeks, okay? Alright, now we remove the stitches on the outside, but we still have a little bit of the stitches on the inside of your nostrils. Now those are absorbable stitches, so they are going to slowly go away. So you may or may not notice that it falls out on its own. So we don't need for you to go through the remove the stitches. Okay?
Okay.
Alright.
All the treatment has been done and now I'm here for my last checkup. Everything has been alright, I feel good and the recovery has been great. I've recovered faster than the average and I'm ready to go home and live with my new nose.